Theophylline is a bronchodilator used long-term to treat asthma and COPD. In this mnemonic video, we'll cover important facts about theophylline, so you'll be ready come test day. Hey there guys, recognize me? I'm Theodore Roosevelt. Even if you don't recognize me, I'm sure you've heard of me. I mean, being president of the United States makes me a pretty big deal. You know, you can use my name, Theo, to remind you of the drug Theophylline. Theo for Theophylline, okay? Theophylline belongs to the drug class of methylxanthines. When you see the drug Theophylline on test day, come back to this mnemonic about me, Theodore, to remember everything you need to know. It's the middle of the night and I'm lying here awake in bed. I think I might need my inhaler, which I keep here on my nightstand. I'll explain why I need an inhaler in a minute, but for now, let's focus on how this inhaler represents treating asthma, because people with asthma often carry around inhalers, right? Theophylline is used to treat asthma. Our next symbol will explain some more details, so let's move on. I keep this hourglass by my bed to keep track of the time it takes to fall asleep, and as you know, hourglasses are well known for their slow trickle of sand. This slow time tracking hourglass is here to help you remember that theophylline is a slow acting medication. Theophylline is taken every 4 to 6 hours long term to help prevent asthma attacks. You may also hear this referred to as a maintenance medication. Because theophylline is slow acting, it should not be used during an acute asthma attack, since its effects won't kick in fast enough for short-term emergencies. Just remember this slow trickling hourglass to remember that theophylline is slow acting. So why am I not asleep? There's a lot of construction going on right outside my window and all the noise is keeping me awake. I think the loudest thing of all is this jackhammer with a bent, blocked exhaust pipe. The way this exhaust pipe is obstructed so the air can't come out reminds me of a condition called chronic obstructive pulmonary disease, or COPD. Patients with COPD have obstructed airflow that can make breathing difficult. In addition to treating chronic asthma, theophylline can be used to treat COPD, which is also a chronic condition. Remember that since theophylline is slow acting, it shouldn't be used in an emergency. Now, let's move on to some side effects of theophylline. It's dark, and as I blindly feel around my nightstand looking for my inhaler, I accidentally knocked over a bottle of pills, spilling them onto the floor. You can use this jumble of spilled pills to remind you that theophylline has a lot of drug interactions, and I really mean a lot. This is actually a big reason why theophylline isn't really used much anymore. Some medications increase theophylline levels, like beta blockers and fluoroquinolones, while others decrease theophylline levels, like barbiturates and carbamazepine. Instead of trying to memorize the long list of drug interactions, just remember that in general, theophylline is prone to drug interactions, and if a patient is already taking a lot of other drugs, chances are they shouldn't be given theophylline. What else do I keep on my nightstand? My glasses, of course. These glasses give me 20/20 vision, which reminds me, 20 is an important number to know when it comes to theophylline. You see, theophylline toxicity occurs above a measured dose of 20 micrograms per milliliter of blood. Theophylline has a really narrow therapeutic range between 5 to 15 micrograms per milliliter. However, 20 is the number you'll want to remember because it is above 20 micrograms per milliliter that symptoms of toxicity start to occur. Next, let's talk about some of the toxicity symptoms to look out for, starting from mild toxicity symptoms to severe. The construction worker looks like he is feeling nauseous from all the shaking of his jackhammer. All that up, down is enough to make anyone feel queasy. That reminds me, an early and mild sign of theophylline toxicity is GI distress, such as nausea and vomiting. If a patient taking theophylline is experiencing GI distress, it is a good idea to have their theophylline levels checked, because there's a chance they are above the therapeutic range. Like I mentioned earlier, I'm having trouble sleeping because of all the construction noise. The way that I can't sleep can be your reminder that theophylline can cause CNS stimulation. This can present as insomnia and restlessness, but it can also manifest as agitation, nervousness, and excitability. But the construction outside isn't the only thing contributing to my restlessness. While looking for my inhaler, I knocked this can of energy drink into the garbage. Yep, that's the last thing I need right now while I'm trying to fall asleep. Use this energy drink to symbolize caffeine, since energy drinks are chock full of caffeine, right? Just like I'm throwing away this energy drink full of caffeine before going to bed, patients taking theophylline should avoid caffeine, since the double effects of theophylline and caffeine can lead to excessive CNS stimulation. Now let's talk about some of the more severe symptoms of toxicity seen at higher doses. This has got to be the loudest jackhammer on the planet. Take a closer look at how much the jackhammer shakes while it is being used. This shaking jackhammer is our symbol to help you remember that severe theophylline toxicity can cause seizures. You know, since jackhammers cause your body to shake, kind of like how seizures do. If a patient on theophylline starts having seizures, the dose should be held, seizure protocol initiated, and the provider notified. You can anticipate that the provider will want blood drawn to test the patient's theophylline levels. The construction worker on the jackhammer is trying to talk into a walkie-talkie, but the screen of the walkie-talkie is just showing a bunch of static. The static on the walkie-talkie looks pretty similar to a rhythm strip on a heart monitor, don't you think? But not a normal sinus rhythm, that's for sure. The static on the walkie-talkie is our symbol for cardiac arrhythmias, since severe theophylline toxicity can manifest as arrhythmias, specifically supraventricular tachyarrhythmias, like atrial fibrillation. If not treated, these arrhythmias can become fatal, so it's important to keep an eye on the patient's heart rhythm during treatment. All right, that's all for this mnemonic. Let's recap. Theophylline is a medication that is used to treat asthma and COPD. It is a slow-acting drug and should not be used in emergency situations. Theophylline causes lots of drug interactions, which can contribute to drug level fluctuations above its narrow therapeutic range. Importantly, symptoms of theophylline toxicity start to appear above a dose of 20 micrograms per milliliter. Mild symptoms of toxicity include GI distress and CNS stimulation. To avoid exacerbating the CNS stimulation, patients should avoid caffeine while on treatment. More severe symptoms of toxicity seen at higher doses include seizures and arrhythmias. And now we're actually done with theophylline. See you next time.